Meanwhile, 24 health workers in the Mfantsiman municipality have been infected with the coronavirus disease. The situation, according to Municipal Health Directorate, has hugely affected the staff strength, as many of the health staff who have been exposed must go into isolation. Deputy Director of Nursing Services at the Mfantsiman municipality, Theresa Nana Yankson, says her outfit has had to reorganize its staff to ensure that the staff left are able to handle the workload at hand. Richard Kwejonya has more in the following report.
The 24 house staff who have tested positive for the virus is out of the 72 recorded cases in the municipality as of June 9, 2020. Deputy Director of Nursing Services at the Sorpon Government Hospital, Theresa Nana Yankson, gives details of recorded cases, recoveries and deaths.
Mr. 3 of them have been on treatment, out of which 36 have recovered and discharged, giving us recovery rate 57.1%. One death has been recorded in the municipality. 24 health workers have been infected with the disease in their line of duty. We pray for all affected individuals and wish them speedy recovery.
She laments the infected workers and their contact at the hospital, some of whom are also health staff, had been quarantined, and this has had a further toll on the staff strength.
Yes, in case a staff gets infected, all the units, the staff around that particular staff, will be quarantined, and in effect affect the clients or the patients. So it really affect the staff strength. We will try and read some reshuffling. We pick some of the nurse and go to that to help. That's what I've been doing, even though it's still not the best.
Theresa Yankson says it's obvious that inadequate PPEs were a hindrance to the fight against the coronavirus and appealed for public support.
As all of you might have been aware, the inadequacy of PPE and the important logistics like non-contact infrared thermometer, liquid soap, tissue paper, etc., have been a major hindrances facing us in the fight. Government has done a part by giving some of these items, but because they are mostly disposable, they will never be adequate, and hence the need for frequent supply of these items.
The Pacific Oil Company Limited donated PPEs to the hospital valued at 30,000 Ghana cedis. Operations Manager of Pacific Oil, Sunday Bayabua, said they donated the PPEs in response to appeals made by health officials in the municipality over the rising cases of infected health staff.
As part of our corporate social responsibilities and in giving back to the community, we thought it wise to donate PPEs to those facilities in order to help the government in fighting the novel pandemic, COVID-19. The area that we donated, Mfantsiman, we understand a lot of health workers have been affected or have been infected with the COVID-19. So that's informed our decision in choosing Mfantsiman.
Richard Kwejonya, Joy News, Cape Coast.
The Ghana Medical Association is meanwhile calling for more attention for frontline health workers as 70 doctors test positive for the virus. Joining me via Zoom for more is Dr. Titus Bayo, Deputy General Secretary of the Ghana Medical Association. Doc, how are these 70 doctors faring, and how is this affecting the country's fight against COVID-19?
Good evening, Aisha, and good evening to your viewers. Indeed, a lot of these doctors have already recovered. This is our count from the time the pandemic started. And so some have recovered and are back to work. Others are still in the process of self-isolation and waiting to be tested again to be confirmed. So to a large extent, they are doing well. As we speak now, there's no doctor in intensive care anywhere, but we have doctors who are still positive, who are waiting to be confirmed negative. And in terms of the impact on healthcare delivery, yes, it's not only those who test positive, but even those who have to isolate because of exposure. It affects the workforce. And that is why we are expressing concern and asking for measures to mitigate against this trend.
So you're calling on government to pay attention to frontline health workers. What exactly are your demands?
So the first thing is the issue of testing. We think that testing of health workers should be prioritized. We've made this call over and over. We have heard that it is in the policy that they should be prioritized, but on the ground, we are not seeing that. You have samples of health workers taken, including doctors, and sometimes it takes weeks, days for the results to come back. And this is not inuring to good to our fight. Secondly, hospital-based samples, patients that we've taken their sample, and we need the results to take critical clinical decisions. The delays also in this group is unacceptable, because it is by these two means that mainly we get a lot of health workers exposed. So we are calling for prioritization of samples coming from hospitals, either from patients or health workers there. And then finally, an improvement in the PPE distribution and availability to health workers to use. This can help us minimize the risk of exposure among doctors and health workers in general.
Dr. Bayo, hold on for me. I want to bring in Daniel Chum Tinkran, who is the General Secretary of the Ghana Nurses and Midwifery Association. Daniel, you must be worried that over 160 members of the association have tested positive for the virus.
Can you hear me?
Yes, perfectly well.
Yeah, good evening, Aisha, and good evening to Dr. Titus Bayo and your viewers. Indeed, it's quite troubling. We are in troubling times, but we take consolation in the fact that nurses and midwives are very patriotic people, and we're bridging the storm, and we believe that once the required logistics are supplied, we can deliver the job as we are supposed to. But as was recounted rightly by Dr. Titus Bayo, indeed, it is something that is worrying, especially at this time that patients are presenting with symptomatic, or they come with the disease, having signs and symptoms of the disease. All right. Previously, most of the patients that were coming to our facilities were asymptomatic. All right, and the rate of recovery was quite high. Now that people are presenting with the disease or signs and symptoms of the disease, it tends to mean that they are more likely to decline to critically ill states and the rest of it. So we need to really up our game as a country. But I can tell you that we are really in troubled times as nurses and midwives.
Now, your association complained about lack of personal protective equipment. Is this still an issue? And could this be reasons why many of your members are contracting the virus?
It's certainly the reasons why the people are contracting the virus. We've said it a couple of times that people are not getting in adequate quantities whatever it is required for them to use. Indeed, as I also said, we need to look at the trajectory of the disease and see how best we can modify the management protocols. Initially, we were looking at triage system, putting people in isolation bay and then treatment centers. I think that we need to modify the process now, because people are coming. Once they are showing signs and symptoms or they are suspected case of COVID, I think we need to have an isolation center, okay, where they will be taken care of by people that are well trained and are having the requisite PPEs, all right, before when they test positive, they are transferred to the isolation centers or the treatment centers, all right. So there is a gap and we need to fill in that gap. Otherwise, more of our people, including the doctors, will be infected, all right, because if you admit a patient onto an ordinary ward, it will turn out that the patient is not positive. But later, if the test it becomes positive, what happens? All right, and the delay in coming with the results. Once the results delay, then obviously we are putting ourselves in danger. Several nurses and midwives will pass through the shift, all right, and get themselves exposed. And that's exactly what is happening.
So certainly, government needs to pay more attention to frontline health workers because they are the ones leading the fight against the virus. I'm grateful for your time, Daniel Tenkran Chum, who is General Secretary of the Ghana Registered Nurses and Midwifery Association, and Dr. Titus Bayo is the Deputy General Secretary of the Ghana Medical Association. Still to come.